name is Sandeep Singh Boprai. My pronouns are he, him, his, and I'm from Queens, New York. I was a senior in undergrad, and my mom was actually making lunch for me. And we have a long dining room table, and I had all my books scattered all across the table, and I was studying for my finals. You know, she's like having conversation with me, and she's like, "Oh my God, I can't wait till you graduate. It's gonna be so great, and we just like, I can't wait to find you like a partner. We're gonna have like a fantastic wedding." And I'm like, "Who am I marrying?" Mom's like, "Oh, don't worry about it. I'll put your bio data in like the matrimonials back home in India." And that's kind of like in our culture how it works when folks are getting arranged married. And I just like couldn't focus anymore. And I'm like, I have to like say something. And I'm like, "Mom, like I'm gay." Like literally it's like time froze and she just became so still. She just started crying hysterically. I remember my brother had come back. He just saw like my mom crying and he looked at me and I was like, I told Mom. He was like, "Do you want to take a minute? Like, do you want to like go somewhere for the day? Let me talk to her. Let me see what's going on, how she's feeling." So I kind of just like packed up all my books, everything that I was studying. I called one of my cousins. He came over and I just like stayed at his house the whole day. Later that evening, I came home and I guess my mom kind of calmed down. In Punjabi, God, like we say Vaheguru. Vaheguru is God, right? So she's like, if Vaheguru created you this way and this is the path he chose for you and this is who you are, who am I to question what he made and what he created? And it just speaks to like my mom's character and who she is as a person. So I decided to go to Hofstra University, where I studied Masters of Healthcare Administration. Once I graduated, I was like, I need to join a large health system. I joined Northwell Health, and I started as a front desk receptionist. So fast forward, I went from there to working with the World Trade Center Health Program. And throughout that time, I still had some interactions with my father. So I'm a product of two parents that were married before and have a child each from their first marriage. But fast forward, my dad actually ended up leaving my mom when I was like 7, 8 years old. During the time of working at the World Trade Center Health Program, I had an opportunity to tell my father about my true identity. And unfortunately, the interaction didn't go as well. It became a little violent. It was that interaction that made me understand that, hey, if this happened to me and I'm queer and I'm Sikh, there must be hundreds and thousands of other queer Sikhs out there that are also going through something very similar, but no one is talking about it. That's when I was like, I'm going to utilize social media as a way to create visibility and awareness. There's one person in specific who's actually on the King Sunny B team now. I told him about this idea that I had. I was like, I want to create a social media platform. I don't know how to do it. But he was starting off as a photographer. He was like, why don't we help each other? I'll take some pictures of you. So we took those pictures. I wore my turban and we put them out. Within like minutes, like the pictures just kept getting reshared. I had people that had like blue check marks reposting my pictures. I had people that were like South Asian celebrities posting my pictures. Through that, we created a lot of visibility. We created a lot of conversation. We received a lot of hate, but I think when you are free and when you are liberated, it invokes that. I maybe had like a few thousand followers or something. And I was like, this is not it. I was like, I need to be in the trenches of the work. I need to do like grassroots work, but how do I get there? So Northwell has an HIV service line. I had the opportunity and privilege of being the administrator of the HIV service line for a couple of years here at the health system. A month before COVID hit February, the director of the ID program said that the health system is going to be opening up a transgender program at the in the health system. And they want an administrator to run the program. And I'm like, I'm not trans. And he was like, yeah, but your passion and your hard work speaks so highly that like, I feel like you're going to do a great job. So I agreed. I was like, yeah, I mean, I'll do it. And then COVID hit. We opened up the center in June, I remember. I think it was 2 or 3 days a week we had it opened. We basically, Dr. Rosenthal and I, our medical director, we basically built this from ground up. It was kind of like a beacon of hope for the patients and the community that like, okay, like for this hour and a half, I can get away. Even though I went to school, got a master's degree in healthcare administration, was working at the trans program, had the social media platform, I was like, I need to do more. So I decided to go back to school. And currently, I'm getting a doctorate at the Medical University of South Carolina. Through that experience, I was able to meet Admiral Rachel Levine, who is the first trans federally appointed individual in the United States of America, the Assistant Health Secretary to President Biden. We were able to work and have really invigorating conversations on gender diverse issues and initiatives. That is one of the most proud moments in my academic career. I've continued on to do Sikh, queer, LGBTQ activism. I've continued to be the administrator at this program. I'm in my last year of school. I'm expected to graduate this year in 2024. But I think the fundamental goal is that I want to make sure that there isn't any Sunny that grew up the way that I grew up. That little like queer Sunny that's like sitting somewhere that's like crying in the corner. So when he goes on Instagram or she goes on Instagram or they go on Instagram, they see someone like me and they're like, hey, if they can do it, if they can persevere and they can make something out of their life, so can I.